Hello, everybody, and welcome to the Irish Hypnotherapy Conference 2025 Meet the Speaker Series. Today, we are talking to Scott Sandland. Scott, how are you?
I'm doing great. How are you, John?
I'm very well. I'm very well. You have nice weather over there because it's a lot warmer, I bet you, than it is right here.
Yeah, I don't mean to brag or rub it in, but I'm definitely in California and I'm definitely wearing short sleeves.
Yeah, yeah. Let's not do that.
Yeah,
I know
sorry about that.
most people watching this are going, "It's freezing." Um, so how? So today, really, what we want to do is get to know Scott and get to know what it is that you're talking about at the conference. So, do you want to just give a background to? Some people will know you as the organizer, the creator, the founder of Hypnothoughts. But there's more to that than there's more to Scott than just Hypnothoughts.
Sure. So yeah, a handful. Thank you, by the way. A handful of people watching this know me as the Hypnothoughts live guy. So I do have the conference, which is the Hypnothoughts live conference. It's in Vegas. It's a big hypnotherapy conference, which is a lot of fun.
Yes.
But that's kind of like where I am now. That's not how I got here. And if you kind of rewind and play the tape back, I started off as a clinician seeing clients for pain control when I was 18 years old. I was really fortunate to get great mentors, and I saw clients in clinical settings full time as my only career I've ever had. And I worked in doctor's office, dentist's office, drug rehab centers, uh, taught on staff, worked in teaching situations for different universities. I've taught in three continents and a couple different languages, all on hypnotherapy and the ethics of it and kind of the play of it there. So
Yeah.
that's me. I'm definitely a clinician first, and now I'm a party planner as well.
Do you still have your own practice as well
I
as
do. I
of
see
today?
very few clients, just because I'm so busy with
Mm.
a bunch of other stuff that I do. I've also uh, invented and patented out a bunch of artificial intelligence stuff. So I'm just one of those guys who likes to be a do-gooder, but also an innovator. So I
Yeah.
try to find ways to innovate for good, and sometimes they work. Uh, but yeah, so I do still see clients, a couple a week, and just it keeps the tools sharp, and it makes me feel good to know I've done something productive this week.
Yeah. And is it still mainly pain control you work in, or is it
No,
expanded a bit beyond
the main thing I do, well, I only do things off medical and dental referrals. So
that?
I
Okay.
don't, I mean, I technically have a website. I technically have a couple business cards that the doctor's offices have, but I don't try to get clients at all. They
Mm.
just come find me. So what I see most of my clients for right now is habit change, mostly dental related. So teeth grinding, clenching, things like that. People who grind their teeth when they're asleep. Those are the kinds of things I see clients for, just because it's real easy, low stress, and helps the person.
You said there about working in the medical and dental uh, field for so long. You've worked in hospitals as well, have you?
Yeah, not on staff. I've worked in outpatient clinics that have brought me into inpatient facilities, and I've worked in a couple inpatient facilities that were drug rehab.
Right.
So never worked in a hospital as a hospitalist, but definitely worked in hospital rooms as a hypnotherapist.
As doing like pre-surgical hypnosis or
Mhm.
and habit
Yeah.
change as well, obviously, if you're dealing with addicts.
Yeah, I did. I've done a couple surgeries where the clients or the patients were allergic to anesthesia. And
Right.
so they couldn't use the traditional chemical anesthesia, or for whatever reason, they brought me in. So I've definitely done quite a few oral surgeries and a couple thoracic cavity and skull surgeries.
Right. Okay. Wow. And when you go, how did Hypnothoughts come about, by the way? How did you get,
So
is that like
yeah,
the
so
largest part of your day today?
yeah,
Or is
the
that
way
just
HypnoThoughts
seasonal?
Live happened is the weirdest thing. So I had a website called hypnothoughts.com for
Mm.
a long time, and that was really before Facebook became a thing. That's how long ago this was. So it was sort of right in between myspace.com and facebook.com
Right.
happening. There was this little window where it was called Build Your Own MySpace. And I found this software that I could, and I built hypnothoughts.com, and it was genuinely the coolest hypnosis website on the internet at the
Mm,
time. I mean, we had videos when nobody else had video. So you were watching educational videos and chat rooms and all these things that, are sort of normal now,
yeah,
were special then. And we built this huge community. We had 25,000 members. We had a couple thousand people coming to the site every single day. It was this really cool, vibrant thing before Facebook groups happened. And Facebook groups has changed it, but we had this community and culture.
yeah.
And so we said we wanted to get together and kind of have a meetup at another conference. And that conference said we weren't invited to do so. So we said, okay, we'll just have our own conference and we'll do our own meetup, and the
I,
rest is
I
history.
love that way of thinking. Love it.
Yeah. So we now, we see a lot of people from all over the world. It's a wonderful thing. I'm very fortunate. I went to a lot of conferences early. They were
Mm,
very helpful to me, and I got some great mentors and great instruction early in my career because of it. It was really, profession defining for me. And so
yeah.
I've been hoping to, kind of pay that forward by having the website and now the conference as well.
And what do you find the difference between, say, meeting in person, like at a conference? So if someone's thinking about this, going, you know, I can see all this stuff online or whatever. Why would you
Yeah.
say someone should go to a conference? Because I know what my answer would be, but
Because the things that you can learn online are great. And online education is a fantastic thing that has transformed many industries, ours included. You should learn online, but not exclusively. Because the stuff that you learn in person is the stuff that isn't on the syllabus, but is game changing. It
yeah,
is the follow-up conversation that leads to a thing that builds that rapport. And now all of a sudden you have a mentor. All of a sudden you have a touch point that you can go back and send that person a message online or call that person. And that relationship has that foundation that you can actually call on them. So I think that relationship building and also the unintended lessons are huge
yeah.
reasons to go to a conference.
The unintended lessons is a great one actually because they do happen left, right, and centre at this. For me, it's always been a sense of community where people had worked on their own for so long, and suddenly, they're connected. They're suddenly finding there's a family almost of people who think and act and feel the same and have the same passions.
Well, I think that's such an important thing for us.
Yeah, absolutely.
Because I'll just pick on me. Like, let's pretend I'm really good at this. And like I see clients and they get better. Great.
Yeah,
No one cares. My clients come in and out, they say thank you, but we talk about them, they
correct.
leave, and then an hour, for an hour, and the next one comes. I talk with
Yeah,
them about their stuff for an hour, next one for an hour, and 5 hours later, I get to go home, but no one asked, how's Scott?
correct.
And and when I go home to my loving wife and son, they don't know what hypnotherapy is, and they don't know what my day is like, and I
Yeah,
don't have a water cooler to chit chat with the people in the marketing department. And so there is something quite isolating
there is.
about running a private practice, especially if you're doing it on Zoom these days and you're just doing it from, your guest bedroom with a Zoom. It's very isolating. And so
Yeah,
having that opportunity to be surrounded by people who get how you spend your day and have similar drives and challenges, it is so validating and so like just reaffirming to the
yeah.
choices that we've made in our career to be surrounded by other people who are glad they made the decisions too.
Absolutely. I'm 100%. I mean, Hypnothoughts is a fantastic conference because, you have 800 people there and they're all of the same ilk. Everybody's connected. There's a common theme, and it's going to be the same in Dublin where, last year, like there is a community that's come from this, and we're doing something after this actually. And it's just going to continue, and it just supports each other. So for
Yeah.
anyone who hasn't come to conferences, you will meet and you will connect. But while you're talking there, do you want to, because you've touched on it basically in terms of connecting with your clients and your clients coming in each and
Yeah.
every day, do you want to give an outline of what it is that you're going to talk about and why it is that you choose to talk about it?
Yeah. And if you don't mind, I'll do it in the opposite order. I'll talk about the
Go
why
go for it.
first. Forgive me for
You're
driving
all right.
there.
I'm a big know your why, and the rest comes. Yeah.
Exactly. So when I was I had been seeing clients for a couple of years, but I wasn't secure in my profession yet. I
Mm,
could see people, but I didn't really have my legs all the way underneath me. Um, and so I was still going to trainings and kind of that stage of your career where you're seeing clients, but then you go to
mm,
a weekend class, and then the next week you force those techniques onto every client you see.
yeah.
And that stage of my career, I found myself in three or four classes over the course of about a year and a half that were all really big on you've got to be doing rapid inductions in your client sessions. You've got to learn how to do rapid inductions because they build a lot of rapport, confidence,
Hmm.
expectation, all these things. And I heard these instructors who weren't clinicians. They were trainers who didn't see clients very often. And so they were talking about, look, if you're going to spend all this time on a progressive muscle relaxation, that means you're wasting time that your client's paying for to create change work. And there was this urgency and this rush to get to change work as fast as you possibly can. And every 45 seconds of deepeners is a crime against your client's wallet. And I just think that's so stupid. Um, because if you really have to squeeze every second
Hmm.
out of the induction process, it means you're wasting a lot of time other places. And uh, and just using it as an example, the induction is where we help, and the deepeners are really where we help acclimate clients to the process of hypnotizing themselves and to gaining positive control over this uh, thing in their life.
Yeah.
And I like rapids. I've used many of them with clients, especially in clinical situations where we have to go fast. Dental offices, rapid inductions have happened many, 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 many times. Uh, but when I'm with a client, just taking time to be present with them, to build rapport with them, to listen to them, and then utilize what they're saying patiently is so much. And I hear people who want to jump on the first thing they know how to take advantage of or utilize, who are just sitting there waiting, like
Mm.
leaning forward, waiting to jump on something their client says so they can interrupt them with, I know what to do. Let's get started. Close your eyes. Oh my gosh, here we go. Like there is so much to be said for, I think, like in almost every movie he's ever been in, Ben Kingsley has this kind of quality that is, I am smarter than you. I am reassuring. I am here to be an oracle and a sage of truth. And uh, I think we get to be that if we play the card right. And there's so much utility and value from a just a technical, outcomes perspective, but more importantly, from that client's perspective, you have this opportunity, if you're patient with them, to take the change work you've done and now spread it throughout their life. And you can just say, oh, yeah, we did this thing together. Now here's all this that's going to happen. And if you're focused on just the phenomena and just the, hey, you got to get to work fast, you waste this opportunity to really let this capability that we all have uh, metastasize through their life
Hmm.
and let them believe that they're the agent of change, not me and hypnosis.
Yes.
So the talk is all about this, and that is my why, and that is my what
No,
sort
and I
of all
love it
front.
because um, I love it because for me, the why is always the most important. But one of the first things that you ever learn is that the more you know about your client and the more you can feed them back their real reasons for why underneath it all, which you'll only get by establishing that level of rapport in the first place. So it is that connection that needs to happen. And I think I
Yeah.
remember Ken Guzzo where he talked about, it mightn't have been Ken, it might have been someone else, but they literally talked about how before a client came in, they connected heart to heart, even though the client wasn't even in the chair across from them. And it's that same space of just connecting directly with a client so that
Yeah.
it builds rapport, which allows for change. because the other side of it is trainers will often say it's one session, one session, one session, but depends on what you're working with. It could be three, four, or
Right.
five, and they'll often tell you that. But you've established that level of rapport in the first one by taking that time.
And even that, I refuse to see a client one time.
I used to, and I stopped after experiences. Yeah,
Yeah, I won't see him one time. If a client says I only want to come in for one session, I say go see someone else. I'm here to make sure you're okay.
correct.
And I can't do that in just, 55 minutes and you're off on your way. We might have nailed it. Happens all the time. Great. Hypnosis is neat. Let's take our egos out of this. This
Absolutely.
isn't about me saying I can do this in 55 minutes. This is about me saying, hey, how are you? Are you
Correct.
sure?
I
Are
love
we
that.
really sure? Not so my success rate is good, so that your life stays good. Come back next week. Come back in 3 weeks. I don't care. Like 55 minutes. That's all it takes, guys. Like
Yeah,
if you've got enough time to just have lunch, you got enough time to see that client one more time and make sure that not only is this thing really locked in, but that you've created that flywheel, that allows for more change to happen in their life that they get to take credit for. And
I
that means
absolutely love it.
that change that you've created now is insulated by all this other progress. And it's, from a patient outcome perspective, it is the better thing to do, but also just from a humanity
Of
perspective,
course.
just being present with people more than ever. Uh, People need it. Loneliness is so high that just helping a person feel audienced and understood and validated is a
That's amazing.
wonderful gift.
It's not something that's often said, but yes, loneliness is a huge factor, and it's worldwide. I mean, the internet has made the world smaller, but yet often more isolated. And huge thing. When you say it that way, it really just hits home.
Yeah, we have the ability to understand our clients in a way that most people don't understand them. Not necessarily better, but different.
Different.
And they come to you and they talk about some weird idiosyncratic problem of theirs or some, kind of on the margin thing that they've been putting off and not wanting to talk about. And then they're going to be vulnerable with you. Pour some tea. like
I love it.
spend 5 minutes.
I
Like
love it.
this isn't a body shop, fixing bang fenders. Like these are human beings and we get to sit with them. And our profit margins are so high we can afford to. We don't have a lot of other expenses. We don't
Correct.
have sterilization. We don't have staff. We don't have all those other things that are costs. So we truly, truly can afford to just be
Take
there.
the time.
And magic comes out of this.
It's beautiful. Very, very well put. It really is very well put. I look forward to that. It's going to be a
Yeah.
very interesting talk.
Thank you. Thank you.
Very
I'm
knowledgeable.
looking forward to getting it. And I haven't gotten to speak at conferences lately. So I'm so excited about
There
this.
you go. And of course, you were in Dublin. You did spend time in Dublin many, many years
Yeah,
ago. You're only coming
I
back.
did. I studied ethics at Trinity. I studied the ethics of the Troubles, which was a fascinating class. We had like Sinn Féin guys like coming into the class and talking to us, and like as an ethics class, we were raising our hand and challenging, Sinn Féin decisions and like really hearing about this. And this is obviously, you know,
At the height of it, way
yeah,
back
this
when.
was this was during marching season in about 99, 2000, something like
Right.
that. So it was when things still happened.
Yeah.
Um, yeah. So it was fascinating, but it was also beautiful and wonderful. And I got to, you know, live in Ireland and live on
How
campus at
long did you
Trinity and,
spend
and
here?
do all that. So I'm thrilled to come back.
How long did you spend?
A semester.
Okay. Well, you
And
can
my
come.
family's from Cork on my mom's side. So
The
got to go visit.
best place in Ireland. That's it. Best place in Ireland. You're done now.
Yeah,
You get you a
we're
Cork
done.
jersey when you arrive.
Yeah. Yeah. Swing by Cork. Like, yeah. When you and I were talking in Vegas about me coming out, Carl, and I were talking, and I couldn't lean forward and say yes fast enough. I'm
Yeah.
so excited about getting over there and
That'll be
and
brilliant.
meeting everybody, talking, sharing, listening, learning, all that. really grateful to be invited.
It's going to be wonderful. It's going to be wonderful. Scott, I can't wait to meet you in Dublin again. And we will, for everyone who's watching this, please, Scott, not only is Scott a really nice guy, you're going to learn so much when you are going to his presentation. So for everyone who's watching this, thank you so much for taking the time. And we will see you all in Dublin on the 5th and 6th of April in 2025. Have an amazing day wherever you are.